Hi, everyone. I see some people piling in now. Thanks for joining us. I'm Amanda. We are going to give it a little bit and then we'll start. I see the numbers are climbing, so don't want to start too early, but we are very excited to do this today. This is going to be a good one. So we'll start in about a minute, maybe less. So some people coming in, welcome. All right, it's 5:01. So as people come in, then they can just join us and hop on in the conversation. As this goes, if anybody has any questions, put them in the question part of the Zoom down bottom. And if we can get to them during it, we will. If not, as soon as we are done, we'll save about 15-20 minutes to answer any questions at the very end. So keep your questions coming. And welcome, everybody. My name is Amanda. I am TiZO's esthetician, and I am joined by two amazing people today. So Meghan, introduce yourself.
Hi, everyone. I'm Meghan Rothschild. I'm a melanoma survivor.
And then we have Kyleigh.
Hi, everyone. I'm Kyleigh LiPira. I'm the CEO of the Melanoma Research Foundation.
And we are doing a lot of work this month with Melanoma Research Foundation. 3% of TiZO's sales are actually going to be donated to the Melanoma Research Foundation after the month of May for Skin Cancer Awareness Month. So, Kyleigh, we would love to hear some history on Melanoma Research Foundation and how it got started.
Yeah, absolutely. I would be thrilled to tell you a little bit more about the foundation. So we were founded 26 plus years ago by a patient, a young woman who was dealing with her third recurrence of melanoma. She was a young woman in her early 30s. And at that time, there were very few treatment options, unfortunately. And it was really out of her advocacy and her determination that the foundation was established. And we started off being really solely focused on funding research because there were very few funders in the space. In fact, one of the doctors we work with, Dr. Mike Atkins, who leads the program at Georgetown, says that melanoma was the cancer that gave cancer a bad name back then. You know, there were really few treatment options. Nobody wanted to research it. Nobody wanted to study it. So we were really sort of the first pioneer in that space in funding research. And over the years, thankfully, more treatments emerged and the need to educate and empower patients and caregivers and the community increased. So our mission morphed from just funding research to educating and empowering patients and caregivers and the general public, and also advocating on their behalf. So we advocate on Capitol Hill for issues that impact the melanoma community and the caregiver community. And we also advocate on the state level. So it's a tripartite mission and we're a national foundation. So hopefully we're in a community that many of the participants are in and they can get involved with us.
That's amazing. That's really cool. And bringing awareness is definitely a huge part of just learning and understanding. And Meghan, you said that you were a melanoma survivor. So how old were you when you were diagnosed and what prompted you to get your skin checked?
Yeah, so I was in my sophomore year of college and I noticed that there was a mole on my stomach that had started to itch. It started to get really dark. And I just sort of realized that I was like itching it frequently. And that's kind of how I was like, something's going on here. So I went home for my winter break and went to just a general practitioner, my normal doctor who I was seeing on an annual basis. And I pointed it out to her. And she actually told me it looked fine. And for whatever reason, I said, I'm 19 at the time, you want to hear, that's what you want your doctor to say is everything looks fine. But for whatever reason, I said, I'm not leaving the office until you write me the referral to have it removed. So I got the mole removed. I went back 2 weeks later to have the stitches taken out. It was actually my 20th birthday. And the doctor pulled me in and he asked if there was anyone at the appointment with me. And I was like, no, I'm here alone. And he was like, there's no one in the waiting room that I can go grab for you. And I kind of was like, uh-oh, what's going on here? And it was at that point that he diagnosed me with melanoma. So, from there, it was, of course, just a crazy journey trying to balance being in my sophomore year of college, dealing with cancer, having to go back and forth between my college campus and back home for many appointments. And then I had to undergo a huge surgery about a month later.
Well, good on you for knowing, like, this is my body. I know something's not right and I need to advocate for myself, because that's huge. And I mean, a lot of 20-year-olds, a lot of people in general wouldn't do that. They'd be like, okay, the doctor said I'm fine, so I'm okay. So good on you. I can't even imagine. Kyleigh, how common is melanoma? And would you say that that's a typical experience, or is there such thing as a typical experience?
Yeah, that's a great question. And unfortunately, Meghan's story is becoming more common. In fact, the incidence of melanoma in women under 30 has increased by 50% since 1980. And melanoma rates are climbing every year. This year alone, over 187,000 people will be diagnosed with melanoma. We have come a long way in treatments, and I know we'll be talking about that a little bit later. But in terms of diagnosis, it is climbing every single year, and we're not really getting a handle on those rates, right? They're increasing. So I think for young women, yes, it is typical. It's increasing, and melanoma is increasing. And ask a friend, and I guarantee you, everyone you talk to will know at least one person who's been diagnosed with melanoma.
Mm-hmm. I was just at a skin check with my sister. She was really nervous to go by herself. And she was like, what if I have to get something cut out? And I went with her, and it was nothing, but she same thing. She found a mole and she was like, I need it removed. Let's see. And it's just, the awareness is huge because people are becoming more aware of different moles and itches and spots on their body. So Meghan, what sort of treatments did you have to go through, and what was the experience like for you?
Yeah, so I had to go in for surgery about a month after my initial diagnosis. The doctor, wanted to get me in there sooner, but I was a stubborn college student and didn't want it to interfere with my classes and all that. And they were like, this is really serious. And so I ended up going in for surgery. They had to do a very wide excision around the area where the mole was located. And they also actually took lymph nodes. So they had to inject me with a radioactive dye. They put me under a screen and they sort of watched which lymph nodes picked up that radioactive dye. And then we determined that 7 lymph nodes from under my left arm and 1 from under my right were going to need to be removed. And then from there, they biopsied everything. So about 2 weeks later, we received a call. They felt they had cleared the margins, so there was no residual cancer cells around where the mole was located, and the lymph nodes were clear. So luckily for me, that meant that there weren't going to be further treatments required. So my melanoma had, not spread inside my body yet. So right now, I have to be diligent, of course, about my skin and have to get checked. And I get, you're just talking about your sister's appointment. I can't tell you a dermatologist appointment I've had in the last 15 years where something hasn't been removed. Yeah. So, certainly, no additional treatments right after the surgery, but this is a lifelong journey, unfortunately.
Kyleigh, would you say that that's what most people will experience while being treated for melanoma? Are there other treatments that are common? And Meghan, you can chime in too if you know this.
Yeah, well, first I'll say I am not a doctor and every individual case is different, right? So, Meghan's case is going to be different than somebody else's case, and where she's treated might differ than where somebody else is treated. And I think there's a lot of different factors that go into it. I will say, and I mentioned this at the beginning, there are so many more treatment options now than there were 26 years ago. There were 2 new FDA approvals last year, the first ever in ocular melanoma, which is melanoma of the eye, which is the second most common type of melanoma. And again, that's only detected with a dilated eye exam. So I wouldn't be doing my job if I didn't tell everybody to not only get a skin check, but get your eyes checked, even if you have 20/20 vision. So, there's been major improvements. And in terms of FDA approved drugs, there used to be 2, now there's 19. There are combinations, there's adjuvant therapy, there's neoadjuvant therapy, and there are clinical trials, which are amazing. because you're really getting those amazing treatments that are in the pipeline, right? It's the best that's coming down the pipeline. So I would say no journey is the same. Everybody's journey is a little different. But what I will say for patients who are battling melanoma or have a family member who's battling melanoma is that there are more options today than there ever have been before. And there's so much hope for patients, which is so encouraging. And we have a lot of resources on our website, melanoma.org, to help patients, whether it's to find a clinical trial or a treatment center near them, or to ask our nurse a question. We have a nurse on staff that answers questions for patients. Ask a nurse at melanoma.org. She's an oncology RN. She will respond to your question and help guide you to resources.
That's amazing.
A lot of this has to do with staging too. You know, my melanoma had remained at had been classified at a stage 2. And so I'm sure, you know, you could speak better to it than I could, but I know that obviously with any cancer, the farther down in progression in terms of like your staging where you are, you're going to have more intense treatment. So luckily, like I said, for me, I was at a stage 2 and they felt they had cleared everything, which was great.
Was there anything, Meghan, that like you did in your childhood that you think maybe led to this? Or
Tanning beds, big tanning bed user, loved to be outside without sunscreen on, got my base tan in the tanning bed, and then would go to the beach and just lay out there for hours on end. So many a sunburn in my early years.
I mean, I remember being in high school and it was like prom's coming up in 3 months, so we need to start tanning, or summer or vacation and we need to get that base tan. And it was, nobody really thought about it. It was just, we were going on the tanning bed and you looked good, so you thought that everything was fine. Kyleigh, talk to us more about tanning beds and the dangers that they present.
Yeah, well, I'll start with debunking a myth. So there is no such thing as a safe tan. Base tans do not prevent you from getting burned. So that's another big myth. People think that is the case. And you know, I think there's 2 things here. So first, I will share that a lot of the damage that is done to your skin when you're young will impact you when you're older. So using tanning beds, blistering sunburns. So again, 5 or more blistering sunburns between the ages of 15 and 20 increases your risk of melanoma by 80%. So just think about that. So for parents, you know, again, of young children, really making sure that we're protecting their skin in those adolescent years, because there's a direct correlation to their risk of melanoma when they're older. Tanning beds, it's radiation. So you need to think about it that you are getting very targeted radiation to your skin, your largest organ, which is changing your cells, which is increasing your risk of melanoma. And another stat, you know, again, you are increasing your risk. If you are using a tanning bed under the age of 35, okay, you are increasing your risk of melanoma by 75%. So again, for young people who are going to these tanning beds, it's a carcinogen, right? It's damaging your cells. And I think there's more education now. I think there's more awareness, certainly more than when I was in high school and my friends would work at these tanning beds and we would tan for free, which I think back now and shudder to think of that, but it was true. You know, we would tan for free. And I think, you know, we're working really hard right now as an advocacy organization with the FDA to get a federal ban on tanning beds for minors under 18. So we're meeting with the FDA in June. It's been legislation that has really been floundering since 2008. And we're really hoping that we get the federal ban on tanning beds for minors, because again, it's a state-by-state issue and it's really not enforced, you know, unfortunately. So having that federal ban will hopefully prevent young people from tanning and increasing their risk for melanoma later on in life, which is our goal.
It's crazy to me that tanning beds are still a thing and that people still use them. And that, like, I belong to a gym that used to be huge on their tanning, and it was the gym and tan line. And 2 weeks ago, they just got the beds removed 2 weeks ago. And it's just, I mean, it's crazy to me. And they would get people come in all the time. Like the FDA would come in and they would check the beds and check the bulbs and approve them or not approve them. And eventually they were just like, listen, you can't sell this as a treatment, as a thing in your gym anymore. So instead of getting rid of them right then and there, they stopped selling it, and it was just included in everybody's membership. And if you wanted to go, you could just set the time to yourself, whatever you wanted. I mean, I would see people go in there, set it for 20 minutes and go take a nap in there. And I'm like, are you kidding me? And then about 2 or 3 weeks ago, they actually were just like, you know what, we're going to get rid of them. And it was like, thank you. I don't know why they are still a thing.
It's crazy that it's
Yeah.
crazy to me that it's lumped in as part of like health.
Yes.
You know, like tanning beds and gyms it's
Mhm.
mind-blowing because
It's insane.
there to be healthy, and it's the complete, it's counterproductive.
Yeah, it's absolutely mind-blowing.
I think too, you know, if the melanoma stat doesn't resonate with people, tanning will age you. So, you know, again, using a tanning bed, laying out, your skin will age, your cells will die, you will have premature aging. And again, if that's another piece, I think, especially with the younger group too, just really enforcing that it will age you. You know, it's a fact that you will age faster by using tanning beds and tanning.
And it's so much easier to prevent aging than it is to reverse. So
Yes, unfortunately.
yeah, unfortunately, exactly. But yeah, it is so much easier to just protect yourself in many ways. Megan, speaking of tanning beds, if you could go back in time, what would you tell young Megan?
So I think I would harp more on the aging thing than I would on the cancer thing, because I really feel like I've had this sense of invincibility when I was younger. And I, you know, even though I pushed to have that mole removed, when I walked out of that doctor's office, I was like, this was nothing. Like, it's not going to come back as anything, you know, like I went to the follow-up by myself because I never in a million years was even worried about what the results were going to come back as. And so I think if I was talking to my younger self, man, I turned 40 next year, and it has like been an uphill battle to reverse the hands of time. And, you know, the things that if I could play to that vanity piece, which sounds insane, right? But 19-year-old me wouldn't care about a potential cancer diagnosis. 19-year-old me would care about what I was going to look like in 20 years.
Yeah.
And so I think that is a big piece of it. You know, and a lot of people ask me, you know, ask me that question, and they kind of couple it with, would you change anything? And I honestly don't think I would, because my journey has been really focused on the awareness piece. And, you know, I've been a national spokesperson for multiple organizations. I won an award from Cosmopolitan magazine. I've been in all sorts of media and got to do media tours for this. And so I don't think I would change my experience, but I definitely would sit my younger self down and be like, you're crazy. Like, what you do now is going to impact you. And it doesn't feel like it's something you have to worry about now. But when you get to that age, you're going to be pulling your hair out, wishing you had not done these things.
Yeah. Like, you're definitely using your platform to bring awareness to this. I absolutely think that everybody in general, but especially younger people, are always like, nah, it could happen, but it's not going to happen to me.
100%. 110%.
Yeah. I mean, like you said, aging, that's scarier than getting cancer, because what are the chances of me getting melanoma? You know, that's the way people think.
Yep,
Mm-hmm.
for sure.
And Kyleigh, I know that you gave us a whole bunch of facts, but if there's one thing that you could ensure everybody knows about melanoma, what would it be?
I think there's two things. And I've worked in cancer for a long time. I was at Johns Hopkins for about 10 years working in oncology, dealing with a lot of different types of cancer, melanoma being one. And I think the big fact is that melanoma is preventable, right? There are not many cancers we can say, hey, you can prevent this cancer from ever happening. We know that we can prevent it. Almost 90% of the time it's preventable. And a lot of that goes back to what I was sharing earlier about, you know, being young, the blistering sunburns, you know, certainly never using tanning beds, but it's really a lifestyle choice, right? It's wearing sunscreen, it's seeking shade during those really hot parts of the day, you know, between 10 and 3. It's wearing UPF clothing, it's wearing a hat. It's really being aware of your skin and using sunscreen and reapplying. That's a big piece, right? People don't reapply and then they get burned, but it's preventable. And I think, again, everybody's been impacted by cancer in one way or another, whether it's melanoma or another type of cancer. And I think we've all thought, like, gosh, wouldn't it be wonderful to prevent this, right? And I think melanoma, we know that melanoma is preventable. And we also know that melanoma is very treatable if it's caught early. So, thank goodness Meghan's melanoma was caught at stage 2. If it was 3 or 4, which is advanced melanoma, it's a different story. It's a different treatment regime. It's a different outcome. So again, it's just so important for people to understand that this is a cancer that's preventable, a cancer that's early, that is very treatable if detected early. So again, seeing your dermatologist every year, knowing your own skin, doing a self skin check. If you see something different, something's changed, again, Meghan talked about that mole on her stomach where all of a sudden it was itchy and that was different. Getting in to see the dermatologist as quickly as possible, because again, that will directly impact your outcome.
And I'd love to piggyback off of that and stress the dermatologist piece, because I think that, I'm not in any way knocking primary care physicians, but they have a lot to consider when they're looking at the patient. They are literally trained to, head to toe, assess what's going on. And skin is not a specialty, whereas dermatologists spend years focused on just the skin. And so I have a lot of people who will ask me, well, I saw my primary care and they did they looked at something quick for me. And I'm like, yeah, but are you getting a full annual skin exam? Or is your dermatologist really tracking and taking pictures and measuring your moles and making sure that nothing is changing or growing or blistering or, itching, all of those warning signs that we know about. And so that's another piece. Like I always say to people, if you are making an educated decision to continue your sun exposure, continue your tanning bed regime, whatever it is that you can't live without, at the very least, establish care with a dermatologist and be seeing them on a regular basis, because they're going to be the ones who can assess something quickly and say that needs to come off. And as scary as it sounds to get something taken off, it is a lot easier than being diagnosed with melanoma and having to go through that experience.
And also with the dermatologist, they can see places on your body that you can't see.
Exactly.
Your back, behind you, your scalp. Exactly. There are places that you're not going to think of. Is it true that, skin cancer is a lot of the time in between the fingers and in between the toes?
Nail beds.
Yeah.
Yeah, on your nail beds. And for all the women who get, the gel nails and putting your hands under those UV lights, I would strongly encourage you to stop doing that. Again, melanoma can form underneath your nail beds. It looks like a dark black line. That's actually how Bob Marley died, was from melanoma on his toenails. So again, it's really important that you see a dermatologist, I think to Meghan's point, that really does that full body. I know it's uncomfortable. Our campaign is #GetNaked. We're trying to normalize, getting naked in front of your dermatologist, having a partner or a spouse, somebody look at your back, look at areas that you can't see, and really get to know your own body and be able to recognize when things are changing.
Now, is it curable or does it enter remission like other forms of cancer?
So the great thing, and I alluded to this earlier, is melanoma, again, we have come so far in FDA approved treatments that almost 50% of melanomas now, because of the new drugs, mostly immunotherapy, enter what we call no evidence of disease. So that's when you can have a scan and there's no melanoma that's visible in your body. And again, that's extremely promising, but we still have 50% of people that are not responding to the FDA approved drugs. So we're in a really interesting point where there's a lot of hope and there's a lot of really great momentum. But again, I think once you have cancer, people are always looking over their shoulder. They're always worried about it coming back. Melanoma can come back. It's not gone forever for every single person. For some it is. So it's a little bit different in terms of melanoma. There's constant surveillance. And I think Meghan will probably attest to that in terms of how she's been living her life and things that probably concern her, on an ongoing basis.
It's every 4 months at the dermatologist. I have not graduated to once a year. I never will. At most I'll be once every 6 months, but right now it's every 4 months, and I'm almost 20 years out. Next year will be my 20-year cancer free, and I'm still every 4 months, and I get moles removed all the time.
It's crazy. We just, we had a comment come through that said I had stage 4 melanoma that did not go into my lymph nodes. My brother currently has stage 2 that has gone into his lymph nodes. So stage isn't really relevant there. And ocular melanoma too. That's actually the first time that I've heard ocular melanoma, which is just crazy to me. And I go to the eye doctor and I get all those tests, but I don't ask what they are. I know that they take pictures and they look and all that, but I just, I do my thing. So it's crazy.
And it is not related to UV light, right? So cutaneous or skin melanoma is almost always related to UV exposure. Ocular melanoma is not. And they really don't know, in terms of research, what causes ocular melanoma. And the only way to detect it is through a dilated eye exam. So a lot of times people will say, well, I go and I get my eyes checked every single year. And I always ask, well, are you getting those horrible drops put in that make you wear those terrible glasses on your way out where you can't see and, you're trying to drive yourself home? I said, if that's not happening, then you are not getting your eyes dilated. And you're probably seeing an optometrist who's having you read the letters, but they need to see the back of your eye. So it's really important.
That's interesting. Really interesting. Thank you. I learned something. Another question that came through, how easy is it to detect basal cell versus melanoma?
So that's a great question. And again, I would say you need to see your dermatologist. Again, to Megan's point, it has to be a dermatologist. You need somebody trained in this specialty. Skin cancer is a visual thing, right? Because you can physically see it, but not all the time. Sometimes things that don't look concerning at all are the things that a dermatologist will remove, and could be a basal cell, a squamous cell, or a melanoma. So, there is no one size fits all when it comes to skin cancer. And I would say that probably if you talk to a dermatologist, they'll share a story of something they thought was a melanoma and wasn't, and something that they thought wasn't melanoma and turned out to be a melanoma. So, I would again just stress to people, melanoma is the deadliest form of skin cancer. Basal cells are slow growing. They're not deadly. They need to be removed, but they're not deadly. And that's why it's really important to see your dermatologist and have them look at it. And like Megan said, be your own advocate. If you're like, this doesn't look right, please biopsy it, force the issue. It's really important.
And I think the other thing to note here is some people produce weird looking moles too. And so my dermatologist, every time he walks in, he goes, oh, my most challenging appointment of the day. And he does the whole scan. And I have many moles that meet, when we talk about the warning signs of melanoma, we talk about the ABCDEs. And I have many moles on my body that meet some of that criteria that he removes, and they come back as completely benign and normal. And there might be moles that he removes that are suspicious and, borderline melanoma in situ. And he's like, gosh, I didn't expect that. So it also comes down to your genetic makeup. So you could look at some of the moles on my body and immediately be like, that is cancerous, that's suspicious. And it ends up not being that way. So definitely having a dermatologist biopsy any spot that you feel is changing or you're not happy with is critically important.
Yeah. All right. Another great question came in. In the future, is there a chance to develop a treatment that targets cancer skin stem cells?
Oh, great question.
That I don't know. I would say there are so many promising things going on right now. You probably heard about the melanoma vaccine, that the news from that with Moderna and Merck a couple of weeks ago now. I mean, that's really promising. There's something called TIL therapy that is very close to FDA approval for advanced melanoma that again is very promising. I think there's so many things on the horizon that are still in clinical trials. So I couldn't speak to that specifically, but right now in this country, in the US, there's over 1,000 melanoma clinical trials going on right now. So a lot in the pipeline, a lot for people to be hopeful for in terms of science and technology and new treatment options.
That's crazy. Megan, so what's your post melanoma journey been like? I know you mentioned going to the derm every 4 months. So explain a little bit about that, and then what measures you take now to protect yourself.
Yeah, so that is really the key, is the protection and early detection. And so I see my derm every 4 months. I personally track if something looks suspicious. I've had moles that kind of like flake or are itchy that I immediately walk in and I'm like, take this off. And it's, it's not fun. Having to get stitches every few months and having to, be in pain and modify my workout regimen and the way I sleep and all that stuff, but certainly worth it to make sure that I'm not, letting something go that could potentially become cancerous or is already cancerous. Obviously a diligent sunscreen wearer, TiZO sunscreen, of course. I love the stick for reapplication. It's one of my favorite products that you folks carry. I always have that in my purse or in my backpack, particularly if I'm traveling. I've been having to go down to Florida a lot for business, and I always have that stick just readily available for me. And not only for the cancer prevention, but now for the anti-aging piece too, like always making sure. I live in New England, I live in Massachusetts. And so obviously we have the intermittent exposure to the sun, but knowing that you have to protect those exposed parts of your body on a regular basis is key. The ocular melanoma thing scares the hell out of me, if I'm being frank. I know someone who passed away from that, and it is one of the scariest cancers in my opinion. I have a thing with eyes, and so I do go to the eye doctor and I do the dilation on a regular basis because I'm very nervous about that. So it's really just, like I said, it's a lifelong journey, like it's a preventable cancer, as we've all talked about multiple times. And so it's all about how I can be proactive, protect myself, make sure the dermatologist is seeing me regularly.
And I know that you mentioned the ABCDEs of skin cancer. For anybody that's watching that doesn't really understand that, if you could just go into that a little bit.
Yeah. So A stands for asymmetrical. So if you have a spot on your body, if you were to draw a line down the middle and fold it in half, if it wouldn't line up, that's a cause for concern. B is border irregularity. So anything that has scalloped or notched edges, doesn't look like a perfect circle. C stands for color variation. So if you have a mole that's like partially brown, partially black, or, getting darker. D is diameter. So anything larger than a pencil eraser is something you would want your derm to keep an eye on, and to measure. And then E is evolution, which I think a lot of skin cancer nonprofits consider that to be one of the most critical pieces, because like I said, you can have a mole that doesn't meet the ABCD piece, but if something is changing, that evolution piece, you want to have that looked at. Because it could be a warning sign of any of the 3 different types of skin cancer that we see. So those are sort of the rules to live by when it comes to skin cancer.
Pretty easy to remember.
Yeah.
I like it.
It's been a while since I said it, so I was like, I hope I remember all these. And I did.
You did great, right? All right. A comment came through. I personally am reoccurring melanoma patient. Unfortunately, we have had multiple surgeries. I've had multiple surgeries, and like Meghan, lots of derm appointments. I must advocate my own health. My first melanoma doctor did not want to remove it, a lot like Meghan's story as well. It's insane. I mean, advocate for yourself. You know your body, what looks right, what's new, you are the most familiar with it. And yeah, I mean, if you see something, say something.
Yep. I was, just to throw in another health issue, I knew I had endometriosis for 3 years and was misdiagnosed for 3 years while screaming, I have endometriosis. And so I think this is a common thing that we get dismissed. I think that there's, a most common answer for everything, right? So if I come in with a cough, right, there's going to be the list of things that the doctor's like, oh, it could be this, this, or this. But the reality is it could be something else. And so that advocacy piece and being demanding. And I always say to people, if you've gone to the doctor, they're not listening, call another doctor. Get a second opinion. I ended up going to Boston for a lot of my post-op care and appointments because I just wanted someone who was really hyper-focused on melanoma. So that advocacy piece, I can't stress it enough.
Yeah, you have to be your own advocate. And I know it's hard when you're the patient. So I would also say for caregivers, they are just as strong as advocates as the patient. And sometimes the patient, they're dealing with a lot, and it's really important to have that caregiver piece too, to advocate for them, if they don't feel comfortable. And I think, I think that's changing a lot. People before felt anxious about getting a second opinion. I feel like people are feeling better about that now. And I just would always encourage, get a second opinion. If you don't like the answer, if it doesn't sit right with you, just get a second opinion. And the other thing I'll just add about the ABCDEs, and this might age me, but dermatologists always say it's also the ugly duckling. So if something looks, and I don't even know if kids read that book anymore, but it's the ugly duckling, right? It's the thing that just doesn't look right. If you have a bunch of moles, but you got one mole that just looks weird, again, that could be a sign that something's wrong. And everybody's skin's different. Some people have a lot of moles, some people don't have any moles. So again, it's just something to look out for.
Let's see, we have some really great comments and questions coming in. My derm told me about a vitamin that prevents melanoma. Accurate?
Well, I would get some more information on that. To my knowledge, there is not a vitamin that can prevent melanoma. And there's a lot of talk about vitamin D and how good vitamin D is for you, for your immune system, and especially for people who are not getting it from the sun. Again, who might live in climates where there's not a lot of sun, or they're covered up most of the time. So again, vitamin D is a very good vitamin. It does not prevent melanoma. And I would just have to have a little more information, but not to my knowledge. There is no vitamin that prevents melanoma.
I hope soon. That would be wonderful.
Yeah.
Could you imagine?
Yeah.
No more gel manicures for me, thank you.
You're welcome.
I feel that one. Yeah.
Don't do it.
No. And how can you prevent ocular melanoma? Would wearing sunglasses daily help?
So there is no way to prevent ocular melanoma, unfortunately, because we don't know what causes it. So it's not related to UV light. It's not related to wearing sunglasses, unfortunately. About 2,000 people a year are diagnosed with it. And again, the biggest thing that everyone can do is get that dilated eye exam. People with lighter eyes, again, are more common in, but there's no correlation to UV exposure. So it's just really important to add that into your annual wellness routine.
That's frightening. That's scary. All right. There's a common misconception about people with darker skin tones and skin cancer. Kyleigh, what does melanoma look like on somebody with darker skin tone, and how can they get early detection?
Yeah, so melanoma is actually increasing in people of color. So the Hispanic population, the Black population, again, and unfortunately, it's in places that don't always see the sun. So acral melanoma, which is on your palms of your hands or the soles of your feet, your nail beds. There's a big misconception that people with darker or tan skin don't need to see the dermatologist. They don't need to wear sunscreen. Again, that's another misconception. Unfortunately, what ends up happening is people of color are diagnosed with melanoma at later stages where there are fewer treatment options available. So again, it's really important. Skin, no matter the color of your skin, no matter the tone of your skin, it's vitally important that you protect your skin, that you see your dermatologist every year, and that they do check places that might not see sun. Mucosal melanoma is a type of melanoma that's in your mucous membranes, in your sinuses, in the vaginal genital area. Again, it's really important that people see their physicians if they notice any changes at all, that they're really alerting their doctor to what those changes are.
The way I look at it is if you have skin, you can get skin cancer, and that's everybody. So yeah, stay protected, get checked. It's scary. Let's see, we have another question that came through. Can you talk a little bit about the vaccine that has been recently approved?
Yeah, absolutely. So this was a clinical trial, so it has not been approved. So I just want to be very clear, this has not been FDA approved. It was findings from a clinical trial that were presented at AACR, which is a big scientific conference. So this is where a lot of data is presented. It is a vaccine that is in collaboration with two different companies, Moderna, who did the COVID vaccine, and Merck. It is looking at taking your own tumor cells and very simplistically making it into a vaccine and injecting it back into you to hype up your immune system and attack the cancer. So this is in stage 3 and 4 melanoma, so advanced melanoma. It's not in someone like Meghan in stage 1 or 2. So this is advanced melanoma, melanoma that has spread to the lymph nodes or melanoma that has spread to distant organs. And they're moving it into a phase 3 trial now. So the first trial had about 157 people in it. So as they go into a phase 3 trial, they're going to have more people undergoing this vaccine. So, you know, again, moving in the right direction. Phase 3 trial is closer to moving towards an FDA approval. So it's very exciting. I will say in the cancer world overall, vaccines have always been the dream, right? So we got the vaccine for HPV, so that prevents that cancer. This would be a vaccine that's a treatment. So it's a little different, right? So it's not preventing it, but it's treating it by using your body's own immune cells to ramp up and attack the cancer. So that's a very simplistic way of taking a very complicated trial. If you want to learn more about it, you can visit our website, melanoma.org. And we break it down in a very layman's terms for our audience, but it's a lot when you take research and try and make it user friendly. So we've done that on our website, and I encourage people to go there and read a little bit more about it. But it's creating a lot of hope, and people are really excited about what the future potential could be.
Now, speaking about your website, tell us a little bit more about Melanoma Research Foundation. What are you guys doing for Melanoma Awareness Month? Where can we find MRF? How can we donate?
All great questions. So Melanoma Awareness Month is year round for us. It's wonderful that there's a month, but for us, it's year round. Our website is very easy, melanoma.org. We have resources for patients. We have resources for caregivers. We can help you find a clinical trial. We can help give you information on treatment side effects. We can help you find a treatment center. We have a lot of great resources. We also have a ton of resources in regards to melanoma prevention and early detection, how to do a self-skin exam. A lot of people don't know how to do that. So we have a guide for that. We have educational materials that are all free. We ship them all over the country. So if you want to take materials to your doctor's office, to your local school, we have those. You can order them online. We will ship them for free to wherever you request them. We have a lot of our events online too. We just kicked off our Miles for Melanoma 5K season here in DC. We're at 17 locations across the country. So you go on our website, hopefully you can find an event near you and join us. They're great community events. And again, we would just love to have people participate and meet other patients and caregivers and people going through the same thing that they're going through. So a lot of really great resources. And then I think I mentioned earlier our awareness campaign, #GetNaked. This year's model is Teddy Mellencamp. She is a Bravo celebrity. She has a podcast, and she is a stage 2 melanoma survivor. And she's had, again, multiple surgeries. And in our campaign, you can see where she's had her surgeries, and she shares her story. And again, similar to Meghan, really tanning when she was younger and developing melanoma in her 30s. So really driving home the message to everyone that, again, prevention, awareness, and protecting your skin is just so critical.
Very, very, very. Another question came through. Is it harder to diagnose melanoma for people with tattoos? It's a cool question.
It's a really interesting question.
Yeah.
I would say, and I think Meghan alluded to this too, and I would love to hear her perspective as a patient. It's all about your dermatologist knowing your skin and you knowing your skin, right? So it's so critically important that you go in every year and get that full body skin exam. And if there is something that they're watching, that they're taking photos of it. I think it's great. We all have our iPhones now or our smartphones, and we can take photos. So, you know, again, it's hard to see if something's changing, but if you have a photo of it, then you can go in and show your dermatologist. So I don't necessarily know if it's harder, but I think it's critical that you're getting a baseline, right? You're getting that baseline exam that you can then track if something is changing.
I think that's definitely where like advocating for yourself comes in, because when you have a tattoo over a certain spot, whether it's black and gray or filled in or not or colored, you'll be able to know if there's something different on your skin that's not normally there, or that the doctor might not pick up on right away.
Yeah, and just to chime in, I'm covered in tattoos, so I have not let it, I know Amanda is too. I have not let it stop me from that joy in life. And so I agree with Kyleigh. I think it's, about having the conversation with your dermatologist. I've also been told not to tattoo over moles. So picking spots of my body that are clear and free from tattoos. I've tattooed over scars, which is a lovely experience, but just being diligent about checking your skin. And to Amanda's point, if I'm pointing here because I just got a new tattoo a couple weeks ago. If I notice something changing on that tattoo, it's going to trigger me to have the conversation with my dermatologist.
All right. And Meghan, as we wrap up, what is your last bit of advice or something that you want to share with everybody? Anything that you're currently working on? Where can people find you?
Yeah. So I have a website, MeghanRothschild.com. I'm also on all social media networks, but Instagram's my baby. So Out with Meghan is my IG handle. I am very excited to be actually traveling with TiZO next month in a few weeks here, going to Dallas for a speaking engagement, getting to share my story at the ICE conference, right?
Yes, correct.
Yes. So that's going to be my next big thing, but I do talk and share a lot, especially during the month of May, with it being Melanoma Awareness Month. I do share additional information about my personal journey and all of that on my Instagram page. So that's where you can find me. And in terms of advice, I think we've beaten the dead horse, right? It's the advocacy piece. It's the watching your skin, doing the self-skin exam at home, talking with a dermatologist about this, and being proactive so that you can not only prevent it, but if something were to happen, you can catch it early.
Absolutely.
The only thing I'll add, Amanda, is for sunscreen, we get a lot of questions about sunscreen. I just want to put 2 plugs in: SPF 30+. So again, that's kind of the baseline of protection, reapplying, and a shot glass bulb. So again, people always think that, oh my gosh, that's so much sunscreen, but it's really a full shot glass. So using that, reapplying, and really reapplying on the kids too.
I think it's the reapplication part that people have trouble with. They'll put it on in the morning and go about their day. But I mean, look at the water resistancy. If you're going to be, running around and sweating and in and out of water or anything like that, water resistancy definitely changes per product. And if you're just putting it on and going about your day, every 2 hours, reapply. I think that is definitely what people struggle with the most.
I would agree.
And all right, so we had a lot of great questions come through. If there's anybody else that has questions, let us know. Just a reminder, TiZO is donating 3% of all of our domestic sales this month in May to Melanoma Research Foundation. We are really excited about that. Meghan, like you mentioned, we are doing the aesthetics conference in Dallas together. We're going to be talking about your story and sunscreen. So I'm really, really excited for the things that are coming up. But if there's anything else you guys want to add, go for it. If there's any questions that come through, we'll reach them. And if not, we'll wrap up in a minute.
Well, I just want to thank you, Amanda and TiZO, for supporting us, and Meghan, for sharing your story. And hopefully we'll see you in Boston this weekend at our Miles for Melanoma event. And I would just like to say, we're here for patients. We're here for the general public. Our website, melanoma.org, we have so many resources. And I would just encourage people that if you need anything, feel free to reach out. You reach out to our nurse, ask a nurse at melanoma.org, or follow us on social media and ask questions. We're here to help patients and their loved ones and educate people.
Be aware of your skin, go to the dermatologist, get your eyes dilated.
Yes.
And thank you.
Really awesome facts.
Thank you as well. And if anybody wants to, have a personal connection and share their own experience and ask more about my story, I'm always happy to answer those questions as well.
Awesome. Well, thank you. You're both awesome resources. So once again, Meghan, what's your Instagram handle if they have any questions?
Out with Meghan, I'll put it in the chat so people have it.
And then melanoma.org if you guys have any questions. And you can always reach out to TiZO if there's questions sunscreen related. Let's say there is another question. Does sunscreen expire? I have found a tube of my favorite TiZO bottle that was in a travel bag from 2 years ago. So yes, TiZO product specifically, we do have a 3-year expiration date. That is if the product is not open. If you do open it, there is on the back either a 6 or 12 month. I think that's also a big thing is a lot of people ask TiZO why we don't have like larger tubes and bottles. But I think what people do is they won't go through the whole thing in the 6 or 12 month expiration date. And then they see it next summer and they put it on, and we can't say if that SPF is still the same. We can only claim that during the expiration time. So yes, it does expire on TiZO. I can speak for that. On the little crimped part at the top, that is where the expiration date is. So please look and check. And reapply your sunscreen, get checked. And if you have any questions, absolutely ask any of these amazing resources that we had today. And thank you. This was an excellent talk. Thank you. Thank you everybody so much for joining us. I learned a lot of information, a lot of really great things. I hope everybody else learned some things. And if there's anything else, just reach out afterwards. But thank you guys so much for joining us. And thank you everybody for taking time out of your day to listen to us today.
Thank you.
Bye.